We're going to get started. And my name's John Reynolds. I'm the Deputy Policy and Advocacy Director here at the ACLU of Delaware. And I'm very excited tonight to have joining us from our ACLU National Political Advocacy Department office, three senior policy counsels who are all some of the foremost experts in their field in the entire country. And we're really, really excited to have them here tonight to chat with them. We have Arli Christian, who focuses on trans justice with the NPAD department. And I'm really excited to chat with Arli tonight about some of the work at the federal level, as well as things that people really need to know as we come closer and closer to some very large decisions that the Supreme Court's going to be making in the near future and that Congress is discussing and voting on right now. We also have Breanna Diaz, who is focused on reproductive freedom and is going to be talking with us a lot about some of the work that's been happening in Delaware, as well as some gaps and areas that we can continue to advance as a firewall for freedom in the first state. And we also have Chad Marlow, who's privacy, surveillance, and technology. That's his thing. And Chad's been actively working with us here in Delaware on what on first blush can seem a little bit perhaps confusing, reverse warrants, but Chad's going to break it down for us and explain how this all relates to gender justice. So as was just posted in the chat, if you have any questions throughout the evening, please feel free to drop them either in the chat or use the Q&A function. We do have time at the close of the program, or I'm going to do my very best to make sure we have time to cover any questions that people have. But without further ado, I'm going to dive straight in and start with federal level. And Arli, I really would love to get your thoughts on what some of the kind of key things that ACLU supporters need to know in this moment. And I was hoping we could start with Skrmetti, the case in front of the US Supreme Court in which a decision will be coming down any week now. So I was hoping that you might be able to share with everyone a little bit about what the case Skrmetti involves and what the ACLU's involvement in that case has been.
Yeah, thanks so much, John, and glad to be with you all. Always nice to be with a Delaware crowd. I'm here in DC, so not too far away. But I'm glad we're talking about, starting with this US v. Skrmetti decision, because it is a landmark case for trans rights, and it could come out literally any day now. It's possible that it may come out tomorrow morning. Anytime really before the first week in July, we are expecting a decision in this very large case. So I'll tell you a little bit about it. The US v. Skrmetti case started back in April of 2023. ACLU and partners at Lambda Legal and legal partners filed a lawsuit against a law in Tennessee that banned gender-affirming care for youth. Now, I'm sure folks have read a lot about various states banning gender-affirming care for youth. We have, about half our states now has some kind of restrictions or laws against this medically necessary care. And these restrictions have really just popped up in the last few years in legislatures pushed by really extreme lawmakers who don't understand care for trans youth. There's numerous lawsuits against these laws, but the Tennessee case has made its way. So I'll tell you just quickly about the history of it. In the district court, we won. The judge in district court in Tennessee gave us an injunction basically saying we cannot let the state of Tennessee let this law take effect. It will harm people. So our young clients in Tennessee were able to continue to get care. Then the case went to the Sixth Circuit, and the Sixth Circuit lifted that injunction, right? Allowing that law to take effect, cutting off care for trans young people in the state of Tennessee. The Supreme Court accepted the case, and oral arguments were last December. It was actually the first time our very own Chase Strangio was the lawyer in the case, argued in front of the Supreme Court, and was the first trans lawyer that we know of that has argued in front of the Supreme Court. Did an amazing job. We were all outside, cheering. And really the question that why this is so important right now, the question in front of the Supreme Court is, does this Tennessee law that bans gender affirming care for minors discriminate on the basis of sex and transgender status, right? And we're saying, yes, it does. So the law bans medical treatments that someone with, a birth sex of male can get, but allows the same treatment for someone with a birth sex of female. If that makes sense. So a non-transgender, a cisgender teenage girl can take estrogen to undergo typical female puberty, right? But a transgender teenage girl cannot. That is on its face sex discrimination, right? Depending on the sex you were born, assigned at birth. So that is the question. And it really gets at this idea of the state is taking a class of people based on sex and discriminating, blocking care for them, right? The related legal question that the Supreme Court is going to get at is that's very important to sort of our legal fights across the country is what level of review do these kinds of laws get, right? So when you have a law that affects trans people and only trans people, do we defer to the government that they know what's best and they get to make that law? Or do the courts look at it with what we call sort of heightened scrutiny, which is like skepticism of what the government is doing, right? And we are arguing, again, this is discrimination based on sex. You should be pretty skeptical of what the government is doing. So that's what we're looking at. I won't run you through all the legal scenarios of what might happen. Maybe we'll know tomorrow morning, maybe we'll know in a couple of weeks, but it's coming soon. But really this decision is likely to impact courts across the country in terms of how they view the legality of these types of bans and other types of laws that affect, really the daily lives of trans folks. That's coming.
Well, thanks, Arli. And for folks who are interested and want to stay in the loop about this case and the outcome, any suggestions on what they should do or where they should look to?
Yeah, follow the ACLU and the ACLU Delaware. We will be sharing information as soon as we have it about the case and the outcome of the case. If the Supreme Court really rolls back our rights, there will be activations, so the day of, if it's not a good decision, we'll be out there in DC in front of the Supreme Court. There will be some activations across the country that following Saturday. So just keep an eye on your local ACLU and local advocacy orgs, and you'll know what's happening.
Thanks, Arli. And for everybody who's watching, if you are interested in getting more information and getting really the distilled advice and guidance from experts like Arli and Chase at the ACLU, as well as Lambda Legal, ACLU in Delaware is working, and we're still finalizing the exact plans. But the Saturday after the decision, we will have a community space happening virtually for people to connect, come and get accurate, clear information about the decision, as well as how and steps that people can take in terms of advocating for what's next. So stay tuned. I can't tell you which Saturday it is because I don't know which day the case is going to come down, but I can tell you it will happen on a Saturday. And so, Arli, I actually would love to now pivot from one federal branch of government, the courts, to talk a little bit about Congress, who have been in the news with what our current president has called his One Big Beautiful Bill Act. And I was hoping to hear from you about how this federal budget reconciliation bill, what does this bill have to do with gender justice?
Yeah, John, it is a good question. I mean, there's really nothing beautiful about the big beautiful bill. It is just, I mean, in so many ways we could talk about that one for a long time, but this bill has so many effects on gender justice. And one on the side of it's pouring money, one into border security, extending tax cuts, lots of other pieces. But really one of the big things we're focusing on is to offset some of the wild and horrible spending that is very anti-civil rights and civil liberties. This bill is cutting hundreds of billions of dollars, particularly from Medicaid and SNAP food assistance program. So from low-income families across the country, millions of Americans are going to lose their health care coverage. And the harms really hit low-income families. They're disproportionately affecting people with disabilities, LGBTQ plus people, immigrant communities, and so many more folks who are relying on this care. So but I'll focus on, there's a couple of provisions in the bill that very specifically attack access to gender affirming care and very specifically attack trans people. And then Breanna, I'll send it over to you for some of the provisions that specifically affect reproductive rights to round out our gender justice hits here. But the first provision in this bill that hits our trans community so hard is it bans Medicaid coverage of gender affirming care, regardless of your age. And this is huge. We have a large chunk of our trans community on Medicaid. 1 in 8 trans folks have Medicaid as their only form of healthcare coverage. And so this is going to have a huge impact on access to care across the country. And the way this happened, the bill as it was written, this bill has only passed the House side. So what I'm talking about right now are these provisions, these horrible provisions that have passed on the House side. It's headed to the Senate now, so we are fighting like hell to get a lot of things changed, but including these hits to our trans community. But what was really horrible about the gender affirming care ban is, the bill was written in an equally horrible way to ban gender affirming care for minors, for folks under 18 on Medicaid. And then there was a manager's amendment, at midnight, the night before the bill passed, and they stripped that language about for minors and made this bill ban gender affirming care for all adults and people on Medicaid. So just sort of a show of the brazen, do not care of some extremists in Congress. And then there's another provision in the bill that prohibits gender affirming care from being considered an essential health benefit. This basically means that plans that are sold on the marketplace, it's not that they can't cover gender affirming care, but it means that coverage is not subject to cost sharing limits that the federal government has in place. So what the effect will be that it increases out of pocket costs and prompts plans to remove that coverage. So it really puts the cost of gender affirming care out of touch for many, many trans people across the country. Breanna, do you want to talk a little bit about the reproductive rights hits in this bill?
Yeah, happy to. And hello, everybody. Happy Pride, by the way. So very fitting to be having this conversation this month at this time. So just really quickly to add on, there are 2 repro freedom specific provisions that are also included in the one big beautiful bill. And those 2 provisions are kind of similar to what Arli has just illustrated for us. So the first provision is what has become known as the defund Planned Parenthood provision. And what it effectively does is exclude Planned Parenthood clinics from participating in Medicaid. But we know that Planned Parenthood is the nation's leading provider and advocate of high quality, affordable sexual and reproductive health care for all people. And that Planned Parenthood health centers provide millions of people in the US, including myself, with birth control, sexually transmitted infection testing and treatment, and life-saving cancer screenings, in addition to other types of reproductive health care services, including abortion. I mean, just to demonstrate how much coverage Planned Parenthood provides, in 2021, 1 in 10 women on Medicaid obtained their family planning services from Planned Parenthood. So by stripping or excluding Planned Parenthood from participating in Medicaid, this provision directly targets low-income patients that Planned Parenthood serves. It will block their access to life-saving preventative care that would be covered by Medicaid when delivered by virtually any other healthcare provider. And that last part where we're saying virtually by any other healthcare provider, the way this provision is written, arguably would only target Planned Parenthood and their clinics to be defunded. We've already seen repercussions of efforts to defund Planned Parenthood and other like legislative schemes or executive schemes, such as like, attacks on Title 10, where we've now seen about 20 Planned Parenthood clinics close nationwide. And sometimes these Planned Parenthood clinics are the only reproductive and sexual health care clinics that exist for communities, in rural communities, for BIPOC communities, and again, like low-income patients and folks. And so this provision really will be taking away that life-saving health care. And then the second provision, it's an interesting one and it's a little wonky, but we're going to try to keep it high level for sake of time. But what the second anti-reproductive freedom provision does is that it bans insurance plans on the Affordable Care Act or the ACA exchange from receiving cost sharing reduction payments if those plans cover abortion care. So that would effectively impose a marketplace-wide ban on abortion coverage in insurance plans that are available on the ACA exchange. And I think, like what Arli mentioned in one of the provisions, this second provision attacking ACA exchange insurance plans is that this was a last minute amendment to OBA that just was placed last minute. Nobody saw it coming, but when we did see it, we immediately knew the harm it would cause. And so just to like quickly clarify for folks who are like, wait, like I thought we couldn't cover abortion, like, via federal funds. You're right. Like for decades, we've had something called the Hyde Amendment, and that is a federal law that already prohibits federal funds from being used to pay for abortion care. However, states are allowed to require in their health insurance plans that are on the market, the ACA exchange, to cover abortion care. And so what this provision does is that it will target individuals that are enrolled in private health insurance plans that provide that abortion care coverage, effectively raising the cost for those enrollees. And so it's going to likely chill health plans and make them not want to cover abortion care because the costs will be so extreme for those people for individuals on those insurance plans. And so while it's not like a mandate prohibiting abortion coverage in those insurance plans, it again is a chilling effect that due to like the extreme rise in costs for someone to have an insurance plan, they're just going to pull that coverage all together, and pulling that coverage from folks who access these types of insurance plans are low income patients yet again. And so we know exactly who these provisions are targeting. They're targeting folks who typically cannot afford health insurance, or maybe don't have access to it. And so we know where the harm's going to be. But I'll stop there.
Well, Arli and Breanna, thank you for that overview. I can't say it made me feel good, but I can say it was very informative. And this is the part of the program where we now get to thankfully pivot a little bit from talking just about our federal government to think about Delaware as a state and talk about state level work that we can do as a state that does care about reproductive freedom, about gender affirming care, and what can we do to protect these rights, not just in Delaware, but potentially beyond our state boundaries as well. And so as kind of a start for this, Breanna, I want to stay with you, and Arli, if you have anything to add here, please chime in. But I want to talk with you about shield laws, Breanna. And I guess my first question is, could you just explain what a shield law is, what it does, and how they function in this context?
Yeah, happy to. We love a shield law. I wish I could see folks be like, how many folks have heard of this term in the last 3 years? I'm always curious how popular it is. And I love the comments that are in in the chat right now. But yeah, so what is a shield law? So shield laws are policies that attempt to shield those who provide, those who are seeking, and those who are helping others obtain abortion care, and sometimes even gender affirming care in their state from civil or criminal repercussions initiated under other states' laws. So, shield law is typically an umbrella term that can refer to like any provision that helps reduce legal risks for providers, patients, and helpers like abortion funds and practical support organizations. But I think to like give like a little bit more of a concrete example of what we mean by that is that, shield laws would show up in a way where it's like an abortion ban state is seeking to impose civil or criminal repercussions on an individual, whether again it is an abortion provider, whether it is someone who obtained a patient who obtained an abortion or like an abortion fund in an access state like Delaware, right? And so these shield laws seek to prevent those types of civil and criminal suits against those individuals for seeking, lawful care in an access state. And so like how do they work? There are currently, I think it's 22 states and DC currently have shield protections that have been enacted via legislation, which is what Delaware did, or executive order, which is like what North Carolina just did earlier this year. But like the components of shield laws really do vary state to state, and right now are kind of being gap filled, which I know we'll talk about later. But how they work in different ways. They can include measures related to personal health information, and we have like the master on personal health information, privacy, and technology on here who might unpack this a bit. But related to personal health information, so like how you all store your data, maybe on your personal health data on like period tracking apps, or like if you have conversations on like social media that relates to like your access to care, right? So personal health information, data privacy, how your which can include like how your information is collected, how it is stored, for how long it is stored, who has access to that information, professional licenses. So, shield laws seek to protect providers' licenses from being challenged by ban states, medical malpractice insurance. There are counter lawsuits, extradition, non-cooperation with like law enforcement investigations from ban states. So there's a lot of different ways this can show up, but I think one concrete example of how we actually have seen shield laws implemented is this case that's going on right now between Texas, Louisiana, and New York. And so, for those who are not familiar, Texas and Louisiana have filed a civil and two criminal suits, respectively, against a New York-based abortion provider for allegedly mailing abortion medication to individuals in those respective ban states. However, New York has a shield law, right? And it has some of those components we just went over, including, anti-extradition provisions and non-cooperation with ban out-of-state law enforcement. And so in this example, Louisiana has actually issued an extradition warrant for the New York provider, which is essentially saying we have charged this provider with violating our state abortion ban, which is a criminal charge. And so we need you, New York, to force her to Louisiana for the lawsuit so we can prosecute her for violating our law, right? However, the New York governor, citing their shield law, has not signed that extradition warrant because she says we have, like the New York governor is like, I don't have to sign that because the care that allegedly was provided by this New York-based provider was lawful in New York. And I don't have to comply with some extradition warrant because, like, again, it's lawful here. And so this is currently an ongoing battle between Louisiana and New York, where this is the first real challenge to a shield law. And I think us at ACLU, we are all watching it very closely to see how this plays out at state and likely how it'll play out in federal court in the near future.
Thanks, Brianna, for that overview. I think as we then think about this wide world of shield laws and how we see them being used right now, I know you referenced Delaware a has something that falls into the category of shield law, and I was curious if you might be able to just share a little bit about kind of what we know are some of the gaps in Delaware's existing shield law that ACLU supporters and we as a state can continue to work to improve and make sure that if Texas and Louisiana chose to sue a Delaware provider, that we were truly providing what we know as the highest level of protections.
Oh, absolutely. And that's a great question. So, um, from my understanding, Delaware's shield law does protect against out-of-state investigations and prosecutions, similar to the New York example I just gave. It covers professional discipline and civil liability related to reproductive health care. Um, so like those protections exist, but where there are gaps that can be filled, I think one big one is that right now Delaware's shield law does not provide similar protections for gender affirming care. Right now, it is focused on reproductive health care. And I think the number I gave earlier of like 22 states and DC that have shield laws, of those, 17 have extend those protections to gender affirming care as well. And so, we have already seen states like ban gender affirming care, states already seek to impose their bans out of state. This happened about a year or two ago when Texas tried to subpoena the medical records of trans youth who sought care, gender affirming care in Seattle Children's Hospital, which is based in Washington State. So like these threats are real, they have happened, and we should fully expect them to happen again. And so when we look at access states like Delaware, I think that is one like glaring gap that we should make explicitly that we should fill. And we can do so by making it explicitly clear that the shield law protections that exist for reproductive health care extend to gender affirming care. And then like just lightly, a couple other things that we're seeing in other shield law states, because, we're in a new political reality with the Trump administration. We're seeing like the first challenge to a shield law play out before us. And so states that already have shield laws are continuing to like clarify their existing laws or build upon them to touch on like other stakeholders or issues they're seeing. And some examples of those like new additions to these shield laws can be expanding, one is expanding non-cooperation from solely out of state individuals or from out of state actions, is to expand that to like federal investigations where it's appropriate under the law. I think a second thing is expanding protections to other reproductive health stakeholders. Right now, they're very focused on like providers, patients, and abortion funds. But there are bills right now, like in Massachusetts, that would extend those protections to like midwives or doulas, as well as attorneys, because we have seen attorneys and folks like in the legal field like be targeted and attacked under this administration. And then one final thing is that we really need to beef up and focus on the data privacy protections, because that is like a lot of we are seeing a lot of concern there. And there's a really bad example that maybe Chad will get into with like Flock, which is this like horrible surveillance system that was recently used, that exists nationwide, but was recently used by Texas law enforcement to track a woman for allegedly seeking an abortion. So those are just a couple things that we can do in Delaware, but should also ensure nationwide.
Well, Breanna, thank you for the segue. I think it's time to bring in Chad. It's time to bring in, he's been teased earlier by Breanna, and it's time to talk about surveillance, privacy, and technology and how it intersects with these issues. So, Chad, obviously, Breanna just highlighted, right? There are many different tools that are being used, from Flock with the looking at license plates and tracking them and using the databases there to capture people's information, and data of all kinds is trying to be harnessed. And I know tonight I was hoping to chat with you. I want to give you time to talk about the threats generally, but then I'd also kind of, as you share that kind of general piece, I'd love for you to specifically share a little bit about what reverse warrants are and how they connect to this data landscape in gender justice.
Sure, and good evening, everyone. So let me describe. So first, let me just say the term reverse warrant is weird and scary. Don't be weirded out and don't be afraid. We'll get through it. So I think the best way to tell you what a reverse warrant is to actually start by briefly reviewing what a warrant is, right? So what a warrant is under the Fourth Amendment to the U.S. Constitution, every person in the United States has a right to privacy. But the right to privacy is not absolute, right? If you are accused of committing a crime and you may possess private personal information that is evidence of that crime, the government can, subject to certain standards, gain access to your private personal information. They do that using a warrant. But the government just can't go in and say, I think Chad committed a crime. I want to look at his private stuff. Give me a warrant. There's standards for that. And what the standard typically is in a criminal case is they have to have probable cause. In other words, a pretty good reason they can articulate to a judge to believe that I specifically, Chad Marlow, committed a specific crime. So if they can provide enough evidence that a court goes, huh, you know, it does kind of look like Chad might have done something wrong, then, for example, they can get a warrant to search my home for evidence I've committed a crime, or search my computer for evidence I've committed a crime. Now, the reason we have these standards is back in the time they were writing the Fourth Amendment, the people drafting it could remember the general warrants that were used by the English pre-Revolutionary War, where they just got what was called a writ of assistance, which basically said you can search anyone's home or anyone's ship at any time you want to see if they did anything wrong. And that's exactly what the English did. They would go on a ship or in someone's home to see if someone was evading English taxes or was disloyal to the king. And so when they got around to writing the Bill of Rights, prohibiting general warrants was the first one of the, well, not the first thing they did. In fact, it was the fourth thing they did, which is why it's the Fourth Amendment. But they created rules around that. Now, a reverse warrant is basically a 21st century version of a general warrant. So it is absolutely the ACLU's position that reverse warrants are unconstitutional. I should say that in the outright. The only major circuit court, federal circuit court, that has actually ruled on the issue, which is the quite conservative Fifth Circuit Court of Appeals, agrees with us that reverse warrants are general warrants. And the reason they say that is what reverse warrants do is they never actually suggest that a specific person has committed a specific crime, so we want their private information. Instead, they're dragnet warrants that say, give me the private information of anyone who could have possibly done something wrong. And they work in one of two ways. The first is based on geography, and they're called reverse location warrants, or sometimes geofence warrants. And what they will say is, and I'll use a gender justice example, I want you to identify every person who was within 500 yards of a Planned Parenthood, every single person, just so I can know who they are. And then I can imagine whether or not they've done anything that I could then charge them with the crime for. And that's going to turn, obviously, a lot of people, and you can take that to a different scenario. Let's say there was a gas station robbery. Give me every person who was within a half mile of the gas station. And it turns all those people into criminal suspects, even though a lot of them were probably, you know, predictably buying gasoline or a Twinkie or riding by the gas station on their bike. But everyone's information that they were in that location during a period of interest gets revealed to the police. And guess what? Every single one of them is now a criminal suspect in the case until further privacy incursions can either prove they're the right person or not the right person. Another gender justice example that I can give is for the other type of reverse warrant, which is a reverse keyword warrant. And there it's sort of the same thing, but instead of focusing on where a person was located, they focus in on a search term that they entered into the internet. So if they search for gender affirming care, a reverse warrant can say, give me every single person, let's say in the city of Nashville, Tennessee, who searched for gender affirming care. And that's exactly what they get back. Obviously, even setting aside whether or not the Tennessee law is lawful and constitutional or not, it's not, regardless of what the Supreme Court ends up deciding. They're going to get those terms, but you can have people searching for gender affirming care who aren't even searching for gender or interested in gender affirming care. They can be doing a research project on it, how it developed, what's known about it, where it's provided, what the different options are. And it has nothing to do with committing a crime, but everyone gets lumped into that category. And so that's what a reverse warrant is. It's a dragnet warrant that asks for every person by virtue of simply being in the wrong place at the wrong time or searching for the wrong term at the wrong time, and turns them all into criminal suspects until they can be proven to be otherwise.
Chad, thanks for that overview and for connecting how these practices around data and privacy are problematic constitutionally, like as a whole, but how they're especially can be abused by states like Tennessee, Texas, Louisiana. We haven't talked about Idaho yet, but Idaho, these types
Idaho's a
of
bad
places,
one.
these places that are actively criminalizing things that in Delaware are completely legal healthcare decisions. And so I think this then leads me to think about our state of Delaware, right? You know, abortion access is legal here. Gender affirming care is legal here. But why is Delaware's decision about how reverse warrants work so important to people not just in Delaware but across the country, who are concerned about things connected to gender justice or just, you know, due process and constitutional rights and warrant requirements as a whole?
Yeah. So, unfortunately, Delaware re-earns the title of the first state when it comes to the first state in being the most important in stopping reverse warrants. And the reason why is because, as everyone from Delaware probably knows, Delaware is the nation's center for companies incorporating themselves. And so if you get, and now let me go to Idaho, for example. So Idaho has a law that actually makes it a crime for a person to help a minor receive abortion care in another state, right? So you are probably not gonna, and Breanna will know this, but I imagine abortion care clinics are pretty hard to find in Idaho. But you're certainly gonna be able to find them in nearby states like California. And so, if they're trying to figure out by virtue of a person's location, if they in fact went to a Planned Parenthood in California, a state like Idaho is very, not necessarily small, but has an extremely low population, and not a lot of companies actually have a connection to Idaho, which therefore makes it impossible for Idaho to get a reverse warrant and serve it on a company in Idaho. And so instead, when they say, well, we can't serve them in Idaho because they don't have what's called the minimum contacts here, where can we go where we can serve it? And one of the most immediate answers to that is the company's state of incorporation. And I want to just give you a couple of examples, because people may say, like, but how does that actually play out? How exposed is my data, you know, if they're simply a Delaware corporation? So let me give people a couple of examples you may not even be aware of. There may be people on this call or who listen to it later who've used an app like Life 360, which is a family tracking app. Like, you know, where is my wife right now? I can use that app. Or Find My Friends is another popular app that's operated by Apple. Well, Life 360 and Apple are incorporated in Delaware. If you're driving somewhere and you're using Google Maps or Waze, which I like because you can have Morgan Freeman give you your directions. But if you're using one of those, Google and Waze incorporated in Delaware. If you're planning to travel somewhere or just on your phone and you're like, is it gonna rain today? Do I need an umbrella? AccuWeather and weather alerts, weather apps, which track your location, are both incorporated in Delaware. And if you're going online to search for information about where to get a pizza or where to get abortion care or where to get gender affirming care, and you're using Chrome, which is Google, Edge, which is Microsoft, or Safari, which is Apple, Delaware, Delaware, Delaware. So unfortunately, you know, there's that, you know, everyone identifies it with being from the movie Spider-Man, but it actually goes back a couple centuries further, the expression, with great power comes great responsibility. Well, Delaware has great power and great benefits by being the center of incorporations in the country. But in doing that, it also exposes the people in Delaware and throughout the country to being served with reverse warrants because of that incorporation. And so Delaware has to deal with reverse warrants, not only to protect people in Delaware from the harms of reverse warrants, but from all over the country in both gender justice contexts and in a variety of other law enforcement contexts.
Well, thank you, Chad, for sharing. I mean, it's a dark picture, but there's a little bit of light here, right? We're not helpless in how we can do this. So could you talk to me a little bit about kind of some of the choices that Delaware can make now to protect from these reverse warrants? Like what are decisions that could be made?
Yeah, my dystopian views of the world don't get me invited to a lot of cocktail parties, but fortunately I do have this pivot that I can do that prevents me from getting kicked out. And there's absolutely something that Delaware can do. And in fact, has been trying to do, although it probably seems a little brown nosy to shout out the ACLU of Delaware on an ACLU Delaware event, but I want to say that, the world today looks a lot worse than it looked 3 years ago. But 3 years ago, the ACLU of Delaware was talking to the state legislature about the world we live in right now and telling them we started out saying there's a chance it was coming. Last year, we said it's coming. And this year, we're going to say it's here. But the thing is, Delaware has the ability to prevent other states from getting reverse warrants. And bear in mind, they will get a reverse warrant from judges in their state, not in Delaware. So you're not going to have any sort of good judge in Delaware saying, no, I'm not going to approve that warrant. If Louisiana wants a reverse warrant, it's going to get one from a Louisiana judge. But if they want to come up to Delaware and use their reverse warrant, yes, Delaware could say, we don't like what you're doing. We don't like the purpose of this. We're not going to support your warrant in Delaware. But the problem with that is, let's say you do that to Florida. You're inviting Florida to respond and say, fine, wait till Delaware needs a warrant served in Florida. We're going to give you absolutely nothing. And if you don't think Ron DeSantis is petty enough to do that, you don't know Ron DeSantis. Or Governor Abbott in Texas, or a variety of other governors. But if Delaware says, you know what, these are unconstitutional to begin with, although the Supreme Court hasn't weighed in on yet. They're dangerous in a variety of contexts in Delaware, but they're even more dangerous for what other states could do using Delaware's incorporations. We're going to not have reverse warrants be a thing in Delaware at all. And then if another state comes and says, I have a reverse warrant, Delaware can say, without provoking them into a tit-for-tat response, I'm really sorry, but we don't have reverse warrants in Delaware. Our own police can't use reverse warrants in Delaware. So I'm afraid we can't do anything with your reverse warrant in Delaware either. And talk about killing 2 or 3 or 4 birds with one stone. You end up protecting the Constitution, protecting privacy, and protecting people not only in Delaware, but all over the country. So it's really a very unique opportunity for Delaware's legislature through the reverse warrant legislation that is going to be pending again in this session to not only stand up for the constitutional rights of Delawareans, but for people, especially people from vulnerable populations all over the country. And that's a final way you can be the first state. You can be the first state in defending the constitutional rights of people all over the nation. And I would strongly invite you to take that opportunity this session.
Thank you, Chad. Folks, I want to say as we wrap up Chad's piece here, if you have any questions, please pop them in the chat. Put them in the Q&A function. I see we've already gotten a few coming in. I'm going to get to them in a second. But one thing I do want to say is, watch this space around reverse warrants. Literally, and not for long, like a few days, we will likely have a bill reintroduced here in Delaware. And exactly what Chad just stated, this is not going to be the first time that our legislature has had to start thinking about this. This is not the first time that our police departments, who we actually unfortunately kind of taught about reverse keyword warrants because they didn't know what they were. These are things that our legislature is going to be engaging with again and needs to make hard decisions. If they're committed to these constitutional principles, if they're committed to gender justice and gender affirming care and reproductive freedom, not just for Delawareans, but full stop, this is a clear opportunity for Delaware to use our pretty unique, our small state, small wonder status to try and make some real changes because of how corporate law interacts with how our state functions. But Chad, thank you for that. So let's get to some of these questions. I think the first one I have came in from Natasha. Thank you for submitting. And Chad, I think this one's mostly for you, but anybody who wants to chime in, please do. And this is specifically about Palantir and Microsoft and their usage of data. And Natasha was just wondering, how do we handle all these kind of data tech aspects of this all? It's super invasive. Do we just boycott these companies? Is that a way that we can deal with it? Is that a way, is that the end around for reverse warrants? Or like what is it that people can do? Is that a solution?
Yeah, so it's a great question and it's a difficult one to answer. Palantir makes bad companies like blush. They're like, hold my beer when you want to think about how bad a company can be. Palantir is a company that has been used by oppressive authoritarian governments all over the world to gather people's data, identify them, and persecute them. And so quite obviously, Donald Trump would find them a really appealing business partner. They're his type of people. But, you can't, it's not possible to live a life in which you don't create a digital footprint in 2025. It's not. Each person has to find their comfort balance. But it means really thinking a little bit more deeply than you might want to about individual decisions you make. When you're going on a website and that annoying thing pops up that says, allow all cookies or choose my preferences, take 2 seconds and choose your preferences and only have the ones turned on that are absolutely necessary for functionality. I hate to say it, but if you are going somewhere for gender affirming care or for abortion care or supporting a friend, you may want to leave your phone at home. If you feel like you absolutely need a phone for purposes, you may want to buy a burner phone. You may want to not necessarily carry around a health tracking app. I actually wear a health tracking ring, but you can be sure the location services are turned off. So you just have to make these tiny little decisions every day to not create the sort of digital footprint that you want to create. Now, I mentioned, for example, reverse keyword warrants. I would never tell someone in 2025, don't use the internet. Don't search for information on the internet. Also, don't believe private web browsers are private. They're not. They only mean private from your household. It doesn't mean private from the world. So again, you just have to make decisions. But passing laws that protect data, passing laws like banning reverse warrants or shield laws that protect data or take away tools that basically take advantage of the mass data collection that occurs in a modern digital society, those are actual steps that the government can take to help large numbers of people. And I would just finish by saying this. The protecting privacy has to be a shared responsibility. We can't just place it on each individual to protect their privacy. Government has a role in passing laws that can keep people safe, and they need to do so. And I want to add, they should stop hiding behind false arguments. Like, if we take away tools, maybe under some bizarre scenario, we'll miss a particular criminal case that's really important to us. You know what? That may be true, but missing a small, low-level criminal, to me, is an okay price to pay for protecting the freedom and liberty and privacy of millions. So let's not let those kind of small, emotional kind of BS arguments get in the way of government taking the actions that it has the responsibility to take to keep all people safe, especially those who belong to vulnerable communities or communities that in 2025 are being specifically targeted.
Thanks, Chad. And as I was looking through the questions, I think Chad just stated this, but I want to emphasize, I saw some questions about, so what's the status of reverse warrants in Delaware? What exactly should we be asking legislators to do? Status right now is reverse warrants in Delaware. There's no law that says yay reverse warrants, and there's no law that says no, right? And we are advocating that rather than just wait till the courts eventually hold that this is unconstitutional and it bars their use in Delaware, we can be proactive. We know this in advance. We know the cost and the harms of these laws, and we can ask our legislators to proactively say Delaware does not recognize reverse warrants.
Yeah, and I just want to add one thing based on the comments, just to clarify something. The bill for this session for reverse warrants is coming momentarily, but reverse warrants are being used by law enforcement in Delaware right now, and they have been for years. So we're not addressing a hypothetical problem. They are actually being used and have been used for quite some time.
Yeah. Yes, and if I saw there's a question about how can we find out more, Chad wrote a very helpful blog that I think Kasira may be able to drop a link to in the chat. Otherwise, I will work on sending out to all the registrants after the program that highlights both what reverse warrants are and also some of the developments and how the work that we've been doing in Delaware and New York and in California with ACLUs has actually resulted in places like Google changing how they handle certain types of data.
Oh, yeah. John, one more thing I just want to add, because I don't want to miss the point. I know there's a lot of people in Delaware who really care about the benefits of having all of these corporations in Delaware and then wanting to remain incorporated in Delaware. So I want to be very clear for anyone listening that the tech industry supports bans on reverse warrants. They actually came out in a very public way for a bill like this in New York State. So if you want to keep tech companies incorporated in Delaware, do them a solid on reverse warrants and ban them, because that's what they want as an industry as well.
Thanks, Chad. So as we're kind of coming down the home stretch, I see we still have some more questions in the chat that I'm going to do my best to get to, but I wanted to come back quickly to Arli because I saw you posted something in the chat specifically around the Medicaid cuts. And what is it that people can do right now to take action or support your work and your colleagues' work in NPAD as we work to try and address these attacks on Americans with disabilities, as well as folks seeking gender affirming care and reproductive care?
Yeah, I mean, I definitely encourage folks to sign our action about Congress, coming down on Congress for even proposing these types of Medicaid cuts. And I think the importance of something that Congress made so blatantly obvious in this one big beautiful bill, the ugly bill, is that it's not just one small community's rights at stake here, right? Like trans folks, for example, which is where my work are, we are not the only ones under attack. We're a very, vulnerable population right now, and one that a lot of fear and misinformation has been thrown around about. And that's why we got a hard hit in this Medicaid, in this budget bill. But they're also stripping rights from folks with disabilities. They're also stripping rights from immigrant communities. They're stripping rights in this bill for the right to bodily autonomy, right? Which we all want and believe. And so we can't leave any part of our rights behind. And I think this bill made that so obvious because, as a trans justice community, we're very small, but in Congress, they are attacking so many of us that we really have to band together and say, absolutely not. And whether or not this bill moves forward, it is up to all of us to say this is not what our democracy should look like. This is not what rights should look like. You cannot take these basic rights to make our own decisions about our bodies, to have our own gender expressions, to be able to participate in society as people with disabilities or immigrant communities, et cetera. They're all connected, and you can see it so clearly in this bill. So it's a really important one to speak up about, and to hold our electeds accountable to, whatever happens here. So
Thanks,
please
Arli.
do take action. Yeah.
So I think just to close us out, I wanted to say thank you to Breanna, to Arli, to Chad, both for all the information you shared this evening, but also all the work you've been doing across the country and, selfishly here in Delaware with us at the ACLU of Delaware and supporters in our state as we try and ensure that we are truly a firewall for freedom and that we're not just the state that has elected the first trans member of Congress, but is willing to stand up and fight for transgender communities in our state, is not just the first state to codify Roe v. Wade, but is also willing to follow through when times are tough, not when they're easy, to actively make sure that we're continuing to be that firewall protecting people's rights. And then with what Chad's talking about, that in these moments where Delaware is in a unique position to not just assist Delawareans, but people across the country, that our legislators do so. So I want to say thank you all. Thanks everybody for attending. And I couldn't end a meeting without one last emphasis on a call to action. If everything you heard tonight about the attacks being made across the country on these issues and on civil liberties as a whole really bothered you, if everything Chad was talking about in terms of reverse warrants, how they're being used, and how they're not just unconstitutional and problematic, but that Delaware has a chance to do something, we have a petition going right now in preparation for the reverse warrants bill being introduced. Kasira just popped it in the chat. Please, please, please click on that, fill that out, and then not just fill it out yourself, but we all exist within communities. And our reason for coming to this work is rarely just because we care about ourselves, but because we care about our families. We care about our friends. We care about our whole network of people that we're connected to both within our state and outside of our state. So if you have others within your community who you know also care about this, please share that petition. Please share the link to this program if they want to learn more, because this is something that is this moment, as Chad was saying, that we need to stand up for privacy. We need to make sure that this isn't individuals left alone to make their choices, but we have a chance to collectively, as a people, as a state, and then hopefully as a legislature, vote in favor of the protections we know are needed in order to make these changes. So I just want to say thank you again, everyone, for coming. Happy Pride, as Breanna. Sorry, I left that out at the beginning. I was so excited to get started, but happy Pride, everyone. Look forward to seeing you all over the course of this month. And, let's go civil liberties, folks.